Namaste, children, and welcome back. Good morning. We are doing the chapter Safety and First Aid. This is a very important chapter with respect to our daily lives. These are simple things we are learning about how to keep ourselves safe, and in case of an accident, what do we need to do to protect ourselves? See, these accidents can happen anywhere, anytime in school, at home, outside in the park. You're playing outside every day. So, just the basic things how to take care of yourself, how to protect yourselves, and in case there is an accident, how to protect yourself from further damage before the doctor can come or your parents can take you to a doctor. So, this chapter is very important from the point of view of our daily lives. Yes. So, as I said, our chapter for today is safety and first aid, and our today's topic is first aid because safety we have covered in the previous class. So, before we start, let's first understand what exactly is first aid. Though we have done it before in previous classes, but the definition says first aid is the first or immediate help given to an injured person before he or she can be taken to a doctor. So first we start with first aid for cuts and wounds. Cuts we all know, a small cut, and what is a wound? Wound is another name for चोट. हम जो हिंदी में बोलते हैं चोट लगना, चोट is called a wound. So any kind of hurt, cut, scratch you have on the skin is called a wound. Any cut or open wound on the skin should not be left unattended as germs can enter our body through them. Our skin basically forms the outer protective covering for our body. So wherever there is a layer of skin, nothing can enter your body. But once the skin gets cut, that means now there is a temporary opening and things from outside, could be harmful germs, can enter your body and cause harm to your body. So the first task is to make sure that we take care of the wound. We need to wash the cut with clean water. Make sure there is no dirt sticking over there because dirt is the thing on which the germs grow and they can enter through the dirt only. So once we clean the dirt, most of the germs get washed away from the top of the cut. Wipe it and apply an antiseptic cream or lotion. Could be Dettol, could be Savlon, could be Neosporin as shown here. There are many kinds of various kinds of antiseptic creams and lotions available. We should use them to clean the area. So if any germs were left in this area, by applying this lotion or cream, we make sure we kill those germs. If there is blood loss, tie a clean bandage or use a band-aid. You have that sticking plaster band-aid available. If it is a small cut, you can use band-aid. If it is a slightly larger cut, you need to tie a proper bandage or a clean cloth on top of it. One must go to a doctor in case of deep cuts. If the cut is very deep and there is excessive bleeding, then don't try to do the dressing yourself at home. You need to go to a doctor. So here we have a small video showing you what is to be done in case of a small cut. This Uncle Ji was working on his bicycle and he got a small cut on his hand. So first of all, you need to clean your own hands nicely, thoroughly with soap and water. It may be your wound or it may be somebody else's wound. In both cases, you need to wash your hands so that no infection can go. Then your wound needs to be cleaned under water and take care that all the dirt and grime is removed. Then you need to apply an antiseptic lotion or a cream. He is applying a lotion using a spray and a pad. So once you apply the antiseptic lotion, all the germs are killed, and then you need to cover your wound with a bandage. Here he is using a band-aid, but if it was a bigger cut, he could have used a proper bandage also. Right? And this way we ensure that no further infection enters our wound, and then he goes back to completing his job of maintaining his cycle. Next we have first aid for burns. How can you get burnt? You can get burnt like shown here when hot water or hot liquids fall on you. You can also get burnt directly by your hand going onto a fire. So both ways, when your hand gets burnt, there is some first aid required. And what is that? In case of minor burns, keep the burnt area under cold running water for some time or apply ice cubes. Now what happens is when you get burnt, there is a lot of burning sensation and pain on the hand. So the first job is to get rid of that pain or that burning sensation, and the best way is to keep it under cold water. Or when you apply the ice cubes should not be directly on the skin. If you apply directly the ice cubes, they can burn. So you actually have to put it in a pad kind of a thing, a carry bag or a cloth, wrap it in a cloth, which we actually called a cold compress. It is called a cold compress. It's a plastic bag kind of a thing in which you put the ice cubes, and then you apply it on the, never apply directly the ice cubes, they can further burn your skin. So once the burning sensation reduces, then what do? Apply an antiseptic cream on that area. And if the burn forms blisters, never try to prick them. What are blisters? Blisters को हम हिंदी में छाले बोलते हैं. छाले बन जाते हैं कई बार when it burns, you get bubble-like structures with fluid inside, liquid inside. Yes, they are called blisters. See, like this one. This is a blister. Blisters should never be pricked or burst, because what happens, this is again, the skin is still protecting. Even if it is a blister, the skin is protecting from further infection entering your body. But once you prick the blister, you open the way for the germs to enter and cause infection. So the blisters should never be pricked. You can cover them with a soft cloth so that they don't get rubbed and get damaged. In case of severe burns, visit the nearby doctor immediately. So small burns we can handle at home, but for severe burns we need to go to a doctor. Now this is a small video again to show how to treat small burns. And here's this fellow called Pick. What is he showing you? First, switch off the pain. Like I said, you have to put your hand under cold running water to make sure that the pain or the burning sensation gone. Good. Now what do? You clean the burnt area well with an antiseptic. See, they have applied an antiseptic and cleaned the place well. And then you can apply a small bandage, which is a kind of a protection against outside infection and germs, and you have to keep watching it for blisters. And if you get blisters, what do? You will not prick the blisters for at least 2 to 3 days. And this way it will help to faster healing of your wound. So next we have first aid for fractures. You see this boy has his hand fractured and it is hanging in a sling. So first of all, what is a fracture? A break or a crack in the bone is called a fracture. You can see the bone here is broken, and it is this broken part which is called the fracture. There will be pain and swelling around a fracture. Always around a fracture there is pain and swelling. You can see this portion is slightly swollen and there will be a lot of pain over here. This is a very good indication that it is a fracture. Ensure that the fractured part is not moved. That is what they've written over here. Immobilize the injured area. That means we have to make sure there is no movement. Why there is no movement? Because the bone is already broken, and the broken bone, you try to move your hand and leg, the bone can move away from each other. The broken part, see, it was broken but sitting in the right place, so it will be easier for the doctor to put a plaster and let them grow back and join back. But you moved your hand and leg, so what happened? The bone moved from its place because of the muscles attached and they are pulling it, and will go and sit in an awkward angle or a weird way, and then they will not be able to join back properly. That is why you have to ensure that there is no movement in the fractured part. Next is a splint or a sling can be used to give support to the broken bone. So what is a splint? A splint is basically, you take a hard structure like this, could be anything, cardboard, wood, a thick paperback book, whatever you can find around, even a pillow, sometimes a thick cushion or a pillow works. You put it around and tie it up tightly with a cloth around it. So that is called a splint. It ensures, let's say the bone was broken here, it ensures that the hand does not move and the bones don't get displaced from the right position. Also, if it is the arm, you can use something called a sling. If this is a sling, you can take any cloth, tie it around like this and suspend your hand in it, and this way what happens is you ensure you don't move your hand too much. If you feel that the person may tend to move the hand, you can tie a cloth on top like this, right? After the sling, tie the sling to the rest of the body like this to ensure further no movement. If it is, let's say it's a small child, or if there is a lot of pain, the person might try to move his hand. Or if he's unconscious, he might try to move his hand subconsciously. In that case, you can tie the sling like this also. Next, the injured person should be taken to the nearby hospital immediately, because that is the best you can do. Beyond that, the doctor has to do. He has to first do an x-ray, check out what is the problem, and ultimately he has to go for a plaster or any other kind of thing he needs, the treatment the doctor needs to do. Next we come first aid for animal bites. The bite of stray animals like dogs, cats and monkeys can cause a disease called rabies. The saliva, you can see the saliva. Saliva is that liquid you have in the mouth, जिसको हम थूक बोलते हैं. So the saliva of these animals contains germs of rabies, and when they bite, the saliva enters the victim's body and causes rabies. Now, since there are rabies germs in the saliva, when this dog will bite a person, this saliva enters. Because of the bite, the skin gets torn, and through the torn skin, the saliva enters the body, and the rabies germs also enter the body, and therefore the person can get rabies. So first of all, what do? You wash the wound with soap under running water. When you do it under running water with lots of soap, you are trying to wash away as much saliva as possible from there, so the minimum amount of germs can enter the body. Then you will apply an antiseptic lotion and cover the wound with a clean bandage. And ultimately, what do? You go to the doctor immediately for the further treatment, because these all we are discussing is first aid. The rest the doctor has to take up what is to be done.
First aid for animal bite. Animals attack when they are provoked or in danger. Even the minor animal bites and scratches may lead to complication. To treat a minor bite, first wash your wound thoroughly with soap and flowing water. Wash the hands also well after cleaning the wound to avoid the infection. Then cover the wound with antibiotic ointment and clean bandage. Consult doctor for further treatment, as you may need a tetanus shot. It is must to take doctor's suggestion in case of punctured or broken skin. In case of major bite after giving the first aid, take the necessary medical help.
Next we come to a snake bite. First aid for a snake bite. If a snake bites, what do? If a person is bitten by a poisonous snake, the poison enters in the victim's body, mixes with the victim's blood and spreads quickly. Here you can see the snake is, they're showing you how much venom there is. Actually, the venom is not there in the tooth. The venom is there next to the tooth. But when you bite, that gland pushes the venom out, and through the bite of the snake, the tooth of the bite, the venom enters the body of the victim. A tight bandage should be tied just above the wound so that the spread of poison in the body may slow down. So we know there are arteries and veins running through our body which carry blood from the heart and to the heart. Yes. So now what happens is, when the poison has entered the body through this bite, what happens? It will go into the bloodstream, and with the bloodstream it will go to the heart, and then the heart will pump it to all parts of the body, and including the brain, which then results in death. The brain cells start dying. So to avoid that, if we can slow down the reaching of this poison to the heart, we will slow down the spread of the poison into the rest of the body. So what do? We tie a tight bandage above the wound. Basically between the heart and the wound, wherever it is the wound and the heart, uske beech mein you will tie the, so in this case right next to it. But make sure that the bandage is not so tight that the blood flow stops completely, because then this area will not get any blood supply and that will lead to further complications. So make sure there is enough space for one finger to go into the bandage. Tight enough to stop the blood flow, but not tight enough to stop the blood flow completely. It will slow down or reduce the flow of blood, but not stop it completely. You have to slow down the spread of the poison, not damage the body parts due to non-supply of blood. Then the victim should be kept calm and taken to the nearby doctor immediately. Why should the victim be kept calm? Have you ever noticed when you are not calm, you are agitated? Agitated means like परेशान हो, घबराए हुए हो, your heartbeat also increases. Yes. Now, if the patient is in shock, वो घबरा गया है, डर गया है, what will happen? His heart will start beating faster. When his heart beats faster, the poison spreads faster to the rest of the body. So it is very important to keep the patient calm so that the heartbeat remains slow down, so that the poison does not spread easily, and then we should take him to a nearby doctor immediately.
There are a few do's and don'ts when it comes to snakebite first aid. First, don't make cuts, apply tourniquets, or put ice on the bite. These can further damage tissue. Do wash the bite with soap and water. Immobilize the bitten area, keeping it lower than the heart, and seek immediate medical care. Depending on how much venom has been injected, treatment can involve the use of antivenom.
Next is first aid for insect sting. So sometimes you may get bitten by insects like bees. This is a bee you can see over here, or a wasp. A wasp is this yellow one, which we see very frequently in Chandigarh, these yellow ones, right? This is called the wasp. Remove the sting of the bee or the wasp. Now what happens is when the animal stings you, the animal itself also dies. This is a little portion of the insect is left here along with the sting. So you have to first remove the sting of the bee or the wasp. Rub some ice cubes on the bitten area, and then apply baking soda for a bee sting on the affected area. If it was a bee, then you apply a bee sting. If it was a wasp, then you apply vinegar on the wasp sting. The yellow ones are the wasp. Wasp agar kaatti hai, then you need to apply the vinegar on it. And if it is the bee which has bitten, then you apply a paste of baking soda on it. Right? Next we come to first aid for nosebleeds. Nosebleeds generally occur in hot weather, in summers generally, and quite a few of us have a tendency for nosebleeds. It's basically a few capillaries tend to burst inside the nose area, and the blood starts coming out from the nose. You need to sit upright comfortably on a chair and lean forward slightly. See, she's sitting and she's leaned forward slightly, kept the head forward, and then what do? You pinch your nose. Use the thumb and the index finger to pinch the nose for 5 to 10 minutes. You pinch the nose. See, this is the area. This is the hard bone. You can't pinch on the hard bone. Only the soft area of the nose can you pinch, and actually the bleeding takes place in this area only. So you pinch in this area and you wait for 5 to 10 minutes. What happens? By the pinching, the capillaries slowly will start forming their own clots and the bleeding will stop. While pinching, breathe through the mouth, not the nose. See, they're saying pinch the nostrils and breathe through the mouth, because obviously when the nose is pinched, you won't be able to breathe. So pinch properly, leaving nose space, and breathe through the mouth.
Nosebleeds are common. When there is bleeding from either or both nostrils, how do you handle it? Sit upright and lean forward. Pinch your nose. With thumb and index finger, apply pressure on the soft part of nostrils below the nose bridge. Continue applying pressure until the bleeding stops. Try to breathe through the mouth while nostrils are pinched. After 10 minutes, release the pressure on the nostrils and check if the bleeding has stopped.
So we see within 10 minutes, 5 to 10 minutes, the bleeding stops. And there's one thing we need to remember, that mostly people say, in olden times people used to say to lie down or to push the head back during a nosebleed. That is not the right thing to do. People used to think there's a lot of blood going out. Oh, we are losing blood, so let's not do it. But no, it's better to let the blood flow out from your nose and it will stop. You will lose maybe 10 to 20 drops of blood, and after that you will pinch the nose and the bleeding will stop. But if you put your head back, the bleeding will continue and you will tend to take in that blood into your throat and your mouth, which is very damaging for the body. So always make sure that you don't put your head back or lie down. In case of a nosebleed, always lean forward and pinch your nose. So with this, we come to the end of this chapter. I hope you've learned a lot of important tips on how to keep yourself safe and how to take care of yourselves. What is the first aid you can give to yourselves or your friends in case of an accident. So with this, we complete the term 1 syllabus also. The question answers will be coming, and you will write out the question answers in your notebook, and a schedule would be shared with you to send your notebooks for checking, right? And with that, we wind up today's class. Take care, stay safe, and bye for now.